So that kind of sets the stage. And remember, what we're talking about here is personal injury attorney advertising and sales. And actually, we're including publicity in that too. But really the goal is to understand the relationship of the S-curve of economics relative to personal injury attorneys, specifically promotions. And when we're talking about promotions, we're really talking about three factors. Number one is publicity, number two is advertising, and number three is sales, and the relationship of all three of those relative to the personal injury attorney market. Okay? So the goal obviously is to have a clear understanding of each one of those, and of those three, the sales category is the most important, and that's what we'll be going into a deep dive near the end, and we're going to finish with what I would use as a typical office for the marketing plan. So actually putting together your marketing plan of step by step what to do, how to do it, and why it works, so you have a crystal clear picture of how to use publicity, advertising, and sales in relationship to personal injury attorney marketing. So real quickly, while we're waiting people to get on board here and some of the latecomers, let me just tell you a quick story. Most of you know I opened 77 offices in 20 states. And I did have I did not, with the offices I opened, I did not teach they just do personal injury. I was real big into a variety. But I did have a personal injury office in downtown. And my main training center was out of Louisville, Kentucky. But what happened with my personal injury story as I was building my chiropractic practice, and I'll just take a minute to share this with you, and some of you may have heard this before, is I knew sales. I knew the basics of sales. And so I essentially took my sales message, and I had a little 19-inch TV that I bought. It was a VHS combination VHS TV I bought at Walmart. And at that time, I was also doing video fluoroscopy and spinal ultrasounds because I had learned already advertising sales, the first level of business, which is how to maximize your time for money. So I already knew how to stay busy. So then I went to the next level, is how to maximize the money for time, and that's typically when you go into higher dollar cases, and that's typically when you're talking about personal injury. So that was the next level I did, and then from there I went to start opening offices. So when I started the personal injury marketing, essentially I went to the core of it, and I walked around with my little 13-inch TV and my VHS and a video fluoroscopy tape. Not that I recommend you don't need video fluoroscopy at all, but this is, you got to remember, this is in the mid-90s. This was before the internet and anything else. And so I would actually go to the personal injury attorney's offices with my VHS tape in and I learned real quick to bring my own TV, because if they didn't have a TV, my visual presentation was shot, because I wanted them to see that video fluoro and the power of those segments moving. So I learned real quickly what I would be the greatest value within the market, within the segment, and I'd essentially show up with my 13-inch TV with a VHS, and then I would take them through the sales presentation and essentially show them, go over the injuries and how the injuries can be valued, show them the VHS. I'd show them, of course, the focus was on intersegmental dysfunction, spinal intersegmental dysfunction, otherwise known as alteration of motion segment integrity. And I'd literally show them, explain it to them, the relationship of the three phases of healing and how it impacts the alteration of motion segment integrity to create a permanent injury. Then I would literally open the AMA guides. So on the other hand, I had my book of the AMA guides and point to the page where the impairment rating was. And so between the visual of my video fluoro and the impairment rating and my sales presentation, I was able to show them what they didn't know and what they hadn't seen before. And so the first case was sent to me. I go to this attorney's office, and he had the typical soft tissue injury case that most attorneys have. No other complicating factors. She did not have a disc lesion, no broken bone. She was in a car accident, went to the emergency room, and then went to the doctor afterwards, had some pain pills, muscle relaxers. So that's kind of a very classic case. And so I'd give my presentation to this attorney. He says, yeah, I've got this patient who's in this injury. The medical doctors say there's nothing wrong with her. So the insurance companies were not even giving her, offering anything, nothing at all. So he had nowhere to go also. So he refers the patient over to me. I work him up, take him through the care. And bottom line is the case ends up going to court because there was absolutely no offer from the insurance company at all. And if you think of it, it makes sense because they had two medical doctors saying there was nothing wrong with this patient. So they felt pretty confident in their position. So we go to court, and he just had me. That's all he had. Now, the injuries were only this. Now, remember, no disc lesions, broken bones, nothing like that. The injuries and the objective documentation that I only had was the cause of the injury relative, or the mechanism of injury relative to the soft tissue injuries documented by the physical examination as well as the symptomatology. And then I took motion studies to document intersegmental motion pre and post treatment. So the only thing I had going in court is my ability to connect the dots between the mechanism of injury and the anatomy involved in the symptoms, and then objectively showing the alteration of motion segment integrity, where I just measured the lines off on the segments, and I was able to show that in this particular case, this person, it was a lower back injury, had normal gross range of motion, but significantly altered intersegmental motion. And when we did left and right lateral bending, her hips would actually, is where all the motion would occur, and all her spine was just locked and stuck together. So that was the one of the objective findings. The other objective finding we had, it was a positive McNabb's line. That's when the inferior facet encroaches upon the posterior facet. You draw a line under the superior vertebra, the inferior portion of the superior vertebra, come across and see if the facet, inferior facet intersects that line. So that was it as far as objective evidence, outside of the exam and the symptoms, subjective evidence. So I was on the stand for 6 hours, and also she had the complicating factor. She couldn't pick up. She had a 6-year-old daughter. She had trouble picking up her daughter. And again, this goes under lifetime enjoyment activities and troubles with work duties under duress. So she had some trouble, pain and discomfort associated with this injury. So it all connected. And so all I did is I explained the relationship of the cause and effect between the accident and the soft tissue, which was documented in the physical examination. I connected the soft tissue injuries with the symptomatology. From there, I explained the 3 phases of healing, each of how my treatment and different treatments impacted the 3 phases of healing, specifically in the 3 ranges of motion, and why this patient had limitations and restrictions and altered intersegmental motion. And I was able to show that to the jury. Altered motion, normal interseg motion, gross range of motion, and the difference, and then explain the different ranges of motion and explain why this person had pain and discomfort with overexertion, not necessarily with gross range of motion. So I was able to connect all those dots, and the lady at that time, I believe she was 33 years old, so she not only got the pain and suffering, but she got treatment for the rest of her life calculated in. So this particular case, I won the maximum of the policy limits. Now at that time it was $110,000 for this soft tissue injury with no disc lesion, no neuropathy and no disc lesion, a purely connective tissue injury. Now once I won that, then obviously that attorney, the floodgates opened with that attorney, and his circle of friends immediately found out. And then, of course, the periphery of the legal community, a few people here and there. But between him and his immediate circle of influence friends, that was essentially it for my marketing. I didn't really have to market for personal injury after that, and that was off to the next stage. And then from there is when I started opening offices. So that's my short story of personal injury and how I kind of got myself on the map, so to speak. So it was definitely a trial by fire. I was on the stand for 6 hours. This was in the mid-90s. I was probably in my late 20s. 6 hours, and here I am testifying against 2 medical doctors. So I was pretty proud of what we were able to accomplish and process through. Since that time, I'd never lost a case in court. Been in court several times, and we've never lost a case in court. And part of that reason is being able to share with the attorney if I definitely have the ability to take him through the court and be able to persuade the jury and show the jury versus talk the attorney out of it and kind of direct him to settle. So that's a large degree of how that happens. And it's just good communication with your attorney. So let's go ahead and get started. There's three major concepts I'm hoping to accomplish today. We're going to stay tight with the timeline. The first major concept that most of you have heard, and all my new clients coming on now, they have to sit through the S-curve of marketing with me just because of how important it is to understand these really basic concepts, especially when you apply them not only just to personal or to chiropractic patients, but to personal injury attorneys, and bring clarity. So when we look at the S-curve of economics, and essentially what that is the utilization of a product or service. And very briefly, essentially what happens is on the left side of the curve is the consumer market that's utilizing or has a perceived need for a product or service. On the right, there's not. And on the right side, they may not actually have a need, or they may. Now, fortunately, with chiropractic patients and personal injury attorneys, they do. Even if there's not a perceived need, they do. And here's why. Let's look at the statistics first. So, and these statistics are from the Insurance Research Council. That's where these statistics come from. And the first statistic is 87% of all patients in automobile accidents have a connective tissue injury. So there's a large segment of the market with a connective tissue injury. And then the majority of patients, the majority of attorneys do not use chiropractors. So 25% of attorneys will only proactively manage a case. In other words, they'll actually kind of direct the patient here and there. And if you think about it, it's kind of like you. If you're not a lawyer, would you proactively try to manage the case? Would you feel comfortable if you tried to manage the case legally? So, and then I've had doctors say, well, how do they, if they don't manage the case proactively, how do they make any money on the case? Well, when patients come to them, they've been to doctors, they have some diagnostic testing, so there's a limited amount of workup that is available right there. But they don't proactively quarterback and manage the case. So that's 75%. And the other big statistic is 32% of personal injury patients. Only 32% go to CAM providers, complementary alternative medicine providers. So the good news and bad news about these kind of statistics are there's a lower number of potential, less than a third. And when we say complementary alternative medical providers, of course that includes chiropractic, and that's acupuncture, massage, chiropractic, etc. So basically 68% of the patients do not see chiropractors. And of that 68%, you have to remember 87% of them have a connective tissue injury. So there's a much greater segment of the population not seeking chiropractic care that has a connective tissue. And the importance of that is we're going to talk about in the very next subject, is the connective tissue injury relative to the advertising sales process. So how big is this market? It's a very large market. So if you look at the left side of the market where there's a perceived need, it's not that big. There's a smaller percentage of people, personal injury attorneys, and personal injury patients who are proactively looking. It's less than 32% of patients, and only 25% of personal injury attorneys are proactively managing cases, etc. And that's exactly was the case with the attorney that I went to. He didn't work with chiropractors, and the main reason is he didn't even know what they did, and it was really just the ignorance of not knowing what we could do that created the fear of him not using chiropractors. So that is how big the market is. Now, if you look at the right side of that S-curve, you go, okay, well, you got 75% of the personal injury attorneys who are not proactively managing the case, whether it's the knowledge base they have, etc. And you have 68% of their clients who do not go to complementary alternative medical providers, chiropractors. So you have this very large segment of the S-curve that's possible. And it's through an understanding of marketing is how to capitalize on the whole segment, not just a very small segment. And so when we say marketing, we're talking about publicity, the combination of publicity, advertising, and sales. And so remember, if there's a perceived need with the attorney, you don't need sales. If there's a perceived need, that's where publicity and advertising come in to attract more of that person who's looking for your services than your fellow competition. But that's if there's a perceived need. If there's not a perceived need, that's the right side of that curve. So there's a lot of personal injury attorneys and personal injury victims or patients who do not have a perceived need. Now, now what's so important about this is they're in a state of unconscious incompetence. And advertising will not do anything for those people. And so sales is what has to apply to that right side. And so we like using a combination of publicity relative to advertising, but definitely sales. It's that combination that will help take the right side of that S-curve, especially the personal injury attorney, and shift their mindset to a state of awareness. And not just a state of awareness, in other words, establishing a need. But obviously we talk about the importance of the different types of needs, whether it's a pain or pleasure-based need. So that a clean understanding of whether you're dealing with the left or the right side, whether you're doing advertising or sales, and a crystal clear understanding of the relationship in sales. And so that's the purpose of all of this, is to create super clarity between the publicity, advertising, sales, its interrelationships, how they work together, and the knowledge base, but more importantly, the absolute core. If you were going to absolutely say what was the #1 best thing you could learn relative to personal injury attorney marketing, and that's sales, because that's the largest segment of the market that's untapped and the least amount of competition. So we're going to go into detail specifically on how to do that and give you the sales presentation on how to do that. So that's where there's the greatest opportunity. Now, when we look, and we're going to talk about conditions in a second, but there's a great opportunity on the right side for two main factors. Volume, so there's a tremendous amount of business on that right side that is in essentially a state of unconscious incompetence. Volume and competition. Now, depending on which segment of injury you go into, you could be going head-to-head, competitive with somebody who's always going to win out over you. So having a clear understanding of which segment of the market to use to your advantage, that has the natural advantage, is also a great asset. So that's what we're going to be covering likewise. So that's essentially when we look at the market, the S-curve of marketing relative to chiropractic. And the big thing about sales, and again, we're going to go into great detail. Toward the end, we're going to go into the sales presentation. But the big concept in sales, there's a lot of minor concepts dealing with demographics, psychographics, geographic, psychographic barriers, vehicle delivery, unique segment position. So all of those are very important to help increase your likelihood of business. But even if you have all of those absolutely correct, and if you can't do these three things to that target market, if you can't take them through the admit, consequences, and personalization phase, you will not get the business. Now, the opposite is also true. If you do terrible demographics, psychographics, geographic, psychographic barriers, vehicles, deliveries, unique segment position. So even if you do a terrible job with researching and kind of putting yourself in front of a better target market, so to speak, but you know sales, you know how to take somebody with no perceived need, and you know how to take them through the admit, consequences, and personalization. And remember, the consequences phase is so important to understand the difference between pain and pleasure and what is the highest versus lowest motivation. And we're going to go into great detail with these categories of sales, admit, consequences, and personalization through the workshop, especially at the end when I cover sales. So that is the important factors relative to the S-curve, is that high awareness of how large the segment of the market is, where they are mentally, and what you have to be able to do on a communication level. And a lot of times I'll say educational sales, just because so many people are afraid or have a distaste for the word sales. But sales is essentially changing somebody's paradigm or awareness to a state of unconscious incompetence to a state of awareness, conscious incompetence, to hopefully creating a need, not just an awareness, but that there's actually a need, and obviously the higher the need, the better, and we're going to make sure we're very clear on the differences of need and how to deliver need with high value to the attorneys. So that's essentially the short of the S-curve. Now, when we attack that S-curve, now it doesn't matter if it's really if we're going after the left side or the right side, and whether it's a personal injury attorney or patient. The essential formula is this. You start with publicity, then we follow up with advertising, and then we follow up with sales. So, and there's a reason that is the formula from left to right, because publicity is essentially third-party trust is what that is, and it's the same thing with testimonials and endorsements. So we definitely want to increase the trust, the vacuum. In other words, we kind of, if you look at the core of sales, it's really a vacuum of trust in one major factor, in its relationship to perceived need and obstacles. That is the absolute core of sales, and we go into detail of that. But essentially, we go after, we have our target market. Now, we've already defined our target market with our demographic, psychographic, geographic, psychographic variables, vehicle of communication, and unique segment position. So now we have the peak of the bell curve with our targeting list. So we're not just randomly going after anybody. And we're going to go into detail with those factors also. But essentially what we want to make sure is we'd like to do publicity first. And that might be something as simple as sending press releases. And one of the best things you can do, that's why all of my clients we're having authors of books, because a book is the most authoritative. It has the highest trust factor from a publicity standpoint. But one of the other publicity things that you can really do is if for some reason you've testified in court, or you've had a unique experience, or you've helped settle an unusual case or on a certain dollar amount. Well, we can very easily take that and turn it into a press release, and then make copies of that press release, and then we use the press release in our publicity, and that just creates third-party trust. And we not only want to do it once, but multiple times, because we're going to use the effects of multiple contacts. Because remember, there's 4 factors that we're always paying attention to in our marketing, and that is trust and confidence. We want to do what we can to increase trust, increase the confidence, and we also want to decrease resistance and defenses. So those are the 4 factors that we're always paying attention to in our marketing. So when we start with publicity relative to the S-curve, essentially what's happening is you're starting to develop third-party trust. The defenses and the resistance are going down, and the trust and confidence is going up, but also a little bit of awareness to your product or service. And essentially what happens is that's when you will get some of what I call the low-hanging fruit. So the people that already have a higher need, that are looking, the publicity alone will help to generate some business to some degree. But publicity is not known for proactively creating a cause and effect relationship. It's specifically used for low-hanging fruit. In other words, people are ready to take the action, but it actually is used to set up the advertising and sales. So be aware that that's how we're going to use publicity. And then we come in with our advertising next. Well, now you have some name recognition and awareness and third-party trust and confidence through the publicity. Then we come in with our advertising, and remember our advertising, we want our advertising to be laser focused. We want the highest probability of personal injury attorneys from a demographic standpoint, from a psychographic standpoint, from the psychographic barrier to the geographics. We want a tight, clean list of the highest probability of potential target market, and then also we want to try to communicate with them in a what I call the vacuum of trust. What's the vehicle of delivery? Whether there's 4 levels of vehicle deliveries, whether it's a cold call, which is the worst way to do business, and you can only expect as much as 1% of business from a cold call because there's not perceived trust or need, to from a cold call to the lead. A lead can be up to 15%, to a referral. Now remember, there's 2 types of referrals. There's the passive referral, and I don't suggest waiting around for that, versus a proactive referral. So you can actually take proactive steps to create business. We go over the psychology of a proactive referral and create business. And then more importantly, the introduction, up to 75%. you can get up to 75% of business through an introduction, and essentially because that has to do with trust. There's higher trust and there's higher need with an introduction referral versus a cold call. So you've already kind of positioned yourself better if you just switch your marketing over to what's called introduction systems or active and passive referral systems, and get away from what's called lead cold call systems. And even if you do use a cold call system, then put them through the system of publicity, etc., to increase trust and confidence and decrease resistance and defenses. So even if you do have a cold call, you can still increase the potential and likelihood in that way. So those are the 4 factors that we're looking at. Okay, now let's go into number 2. So essentially, in conclusion, when we're looking at the S-curve, we're saying, okay, the left side of the S-curve with personal injury attorneys, there's a small segment of attorneys that are actually looking for chiropractors to refer their business to, and advertising will get that business. The right side is over 2/3 of the patients, and over 68% of the personal injury or of the patients, and 75% of the personal insurers are not referring to chiropractors. And we're going to go into exactly why and why not, and how to overcome them, what you can do to change these statistics. So there's a huge potential market of people, of personal injury attorneys and patients who are not using, who definitely could. So we're going to be paying attention to both of them, but especially that right side of the S-curve. So there's a tremendous opportunity there, as well as low competition if you pick the right factors. And so that's what we're covering right now. Now, let's go into the second category. There's 3 major categories I wanted to cover today, and the second category is the conditions. When you are marketing, what are the conditions that are more effective, that you have higher likelihood of getting business versus lower likelihood? Remember, you don't want to do anything just random. So we want to go into a higher likelihood probability situation. So let's look at the conditions. Well, here's the statistics, and again, this is from the Independent Research Council, that the majority of personal injury patients, 87%, have a connective tissue injury. Number 2, that's the highest injury that people will have. Number 2 is a disc lesion, and the studies have shown up to a third will have a disc lesion, which means 2/3 will not. Okay, now this is very important. And the next injury category is the peripheral neuropathy, whether it's tingling, numbness, weakness, etc., is the peripheral neuropathy. And only up to 10% of the injuries will have a peripheral neuropathy, and 15%, and up to 10% will have a mild concussion. So those are the top 4 injury categories. Now, if you as a chiropractor try to compete with a disc lesion, in other words, when you're talking to the personal injury attorney or marketing, etc., and you're trying to compete with the disc lesion, now you have to remember this is from the personal injury attorney's perspective, not the chiropractic perspective. It's about the target market, not you. So when you're talking about the perception of the personal injury attorney, how much value or how well can you as a chiropractor compete against an orthopedist or an orthopedic surgeon with a positive MRI? Well, you can't. And I'm not into this philosophical discussion of treatment. That is not at all what this is about. This has to do with the perception of the consumer and the target market, because their perceptions are reality. So you see, in the personal injury attorney's mind, the orthopedist or the orthopedic surgeon definitely has way more credibility than the chiropractor relative to a disc injury, especially with the objectivity of an MRI and a disc lesion. So when it comes to a disc lesion, are you going to be able to compete, or what's the difficulty of how much you're going to be able to compete with this personal injury attorney who already believes in his mind the credibility of the orthopedic? So you've got a huge trust credibility issue to overcome going head to head with an orthopedic surgeon. So that's not recommended. Number 2 is the neuropathy. So what's the chances as a chiropractor you're going to be able to overcome or compete successfully against a neurologist with a neuropathy, and the objective findings of an NCD or EMG type of testing. Well, you as a chiropractor individually, you're not. So that's another area that'll be much more difficult and harder to get business in. And then the next category is the mild concussion. About 10% of the patients will have a mild concussion. Now, the mild concussion, again, how are you going to be able to compete with a neurologist? And the testing, the objective electrodiagnostic testing of the MD. Remember, it's the MD who has the respect and the credibility, whether we like it or not. By the way, also in Colossus, they also will have higher credibility with the financial drivers in Colossus versus the chiropractor. So, those 4 injuries, when I'm going into market, first of all, how much sense would it make to market outside of those 4 injuries that are even smaller on a percentage basis? So if you even try to go after any other injury smaller than that, you're dealing with a very, very small percentage of injuries, number one. Now, out of those injuries, it wouldn't make sense to try to go head-to-head with disc neuropathy or mild concussion. You're just not going to have that credibility, or it's going to take a tremendous amount to overcome that with the opposing competition. Now, the big segment of the market is the connective tissue injury, because the connective tissue injury, remember, each of the joints, especially the spinal joints, have 3 ranges of motion: the active range of motion, the passive, and the paraphysiological joint space or joint space motion. So when we apply this connective tissue injury to the spine, and of course the importance of the spine is the neural canal, but it also applies, these 3 ranges of motion apply to knee joints and elbow joints, but the neurology is not as important because there's no spinal cord on the knee. So when we're looking at the particular injury, the connective tissue injury is definitely the injury to focus in on as the gateway. In other words, what's the gateway? The gateway is to come into the personal injury attorney, because that is where, one, it's the largest segment of the market. What percentage? 87%. Number 2, that's where you will be able to compete the greatest. Will a orthopedic surgeon be able to compete against you with only a connective tissue injury? No. Will a neurologist be able to compete against a chiropractor with only a connective or a neuropathy? No. Same with mild concussion. Will a neurologist be able to compete with a connective tissue injury versus a mild concussion? No. So now, that's only true if you're aware of the 3 phases of healing and 3 ranges of motion relative to treatment, and how those 3 phases of healing and those 3 ranges of motion impact the financial drivers of a case. Now, if you don't know how to do that, then you won't be able to compete either. Now, let me say that again, the importance of that. If you don't know how to explain, essentially sell, the 3 ranges of motion relative to, the 3 phases of healing relative to the 3 ranges of motion, relative to the financial drivers. And again, the primary financial drivers being the diagnosis, number 1, the impairment, number 2, the duties under duress or lifetime enjoyment activities, number 3, duties under duress, number 4, and prognosis, number 5. So if you cannot connect, if you don't have the ability to connect the 3 phases and explain the 3 phases of healing as they relate to the 3 ranges of spinal motion, as they relate to the 5 categories of financial drivers, you won't be able to compete either. And that's essentially what the sales presentation is. It will take that personal injury attorney from a state of unconscious incompetence, where you will be able to go to the largest segment of injuries, the connective tissue injury, with the least amount of competition. And you're going to be able to point this out. And you're going to be able to explain the 3 phases of healing in a very simple way, and relate that specifically to chiropractic physical medicine as it relates to their injuries, and the 3 ranges of motion, and then specifically how those lead to objective injuries that are permanent and ongoing and pathological, specifically that you can objectify from a diagnostic standpoint, because you have to have objective evidence for the largest financial drivers. So we objectify those using, of course, the injury is alteration of motion segment integrity in the spine, or of course, 20 years ago, that was Biomechanics of the Spine by Panjabi and White, orthopedic surgeons, and I would recommend getting that book. So that's intersegmental dysfunction as it relates to the 3 ranges of motion and the 3 phases of healing, and then to the financial drivers, how to objectify it with the diagnosis, impairment rating, and then how it affects how the lack of ability in the 3rd range of motion, because that is the range of motion that's affected, and we're going to go into this in detail. It's typically, after treatment, active range of motion and typically passive range of motion kind of go back to normal. And that was what happened with my client. She had normal gross range of motion, but at end play, especially when over pressure and joint motion, when she went to pick up, in other words, there were dynamic forces on her spine, when she went to pick up her 6-year-old daughter, that's when she went into overpressure and, on occasion, joint motion. Well, that's when all the neural fibers and the dysfunction occurred and the pain. So, and that's what was documented with those particular situations. So you have the prognosis or the diagnosis, you have the impairment rating, you've got the duties, lifetime enjoyment activities that are definitely being affected because of this healing process in the 3rd range of motion, as well as the duties under duress. So you got all 4 financial drivers with this connective tissue injury. And the prognosis. Well, remember, one of the financial drivers with prognosis is ongoing care. See, people get more money for ongoing care than if they die, generally speaking. If they die, there's X amount of money, there's no more care needed, and that's it. Well, especially if the person's younger and they need some type of rehabilitation or ongoing care the rest of their life as a result of this injury, that is one of the major financial categories that builds a case up financially. And, of course, the importance of physical medicine and ongoing care is very important relative to altered intersegmental motion. In other words, the 5th financial driver, which is the prognosis. We already know, if you've been in practice any time at all, what's the chances of having an injury and not having any types of signs or symptoms down the road as a result of that, or having totally normal intersegmental motion after this injury. I don't know of many chiropractors that would be willing to take a $10,000 or $20,000 or $30,000 check to be slammed in the back end of their car at 30 miles an hour by another car for $30,000, knowing the complications they were going to have to deal with the rest of their life because of the pathology. So when we're talking about the conditions, remember, what's the conditions we want to use as the gateway to come in? Well, the conditions we want to use, number 1 is connective tissue, specifically alteration of motion segment integrity, because it's the highest value and you got the least competition. You don't want to come in the gateway with trying to come in and win a personal injury attorney over with a disc injury, with a neuropathy or the mild concussion. Now, here's the benefits of this, is once you do that, and watch this, what's the chances, let's reverse it out, what's the chances that the patient will be in an auto injury and they'll not, have a concussion but not a connective tissue injury? What's the chances of that? That's rare to slim. If they're going to have a concussion, chances are they're going to have a connective tissue injury. What's the chances of the victim having a neuropathy, in other words, getting in an accident and having neuropathy, and no connective tissue injury? That's very slim to none. So you see, you can have, and the same with a disc lesion. What's the chances you're going to have a disc lesion on MRI and not a connective tissue injury? Well, that's slim to none also. My point being is we're talking about gateways. What conditions are the best conditions and the worst conditions as a competitiveness? Now remember, we're talking about the mindset of the target market, the personal injury attorney, not your belief system. It's their perception and their belief system. So when you go after, when you use the gateway to go in, that's the connective tissue, alteration of motion segment integrity, and you're able to relate those to the 5 financial drivers, well, now you have value. You not only have value, but when you have the ability to show them when they don't do that, and you're able to add up the money and show them how much money they're losing every month and every year. Extrapolate that over the career of a personal injury attorney, and that's a heck of a lot of money. Well, because they don't have much, like that attorney the case that I did. He had nothing. He had 2 medical doctors that saying she was okay. She had no broken bones, no disc lesion. He had nothing. Well, that's the majority of cases right there. The majority of cases are connective tissue lesions with really not much. And there's not a lot of doctors that know how to document it, number one, or explain it. Explain it meaning sales, educational sales. So that's what we're going to be covering, is exactly how, and this is part of the process. So I would strongly suggest to use as a gateway to come in through the connective tissue as the gateway, not these other conditions. Now, the byproduct of that is once you've established that you definitely can document these cases and help support them with the financial drivers, what's the likelihood now that they will also include you with the disc injury, the concussion injury, the neuropathy? Now they will include you in addition to the orthopedic surgeon that they would typically in standard and always use for the disc lesion. You see, that's how you can get in addition to the disc injuries, the neuropathies, and the concussions, is you come in through the gateway and then you go horizontal once they understand the value you do bring, and that it's a combined. So now you not only have the disc injury, you also have the connective tissue, and both of them are well documented and stated. So now you have a combined effect, because chances are if you have any of these other injuries, a disc, a neuropathy, or the mild concussion, you definitely have a connective tissue. So what's the point? The point is, for the gateway to come in, don't violate the line of law extension. That's the number one reason, remember, that products and services never make it into the marketplace. And that's being everything to everybody. And that's the big fear with small business owners, and especially chiropractors, is they're afraid to let go of something, because then they'll go, well, I won't get that business. Where if you knew advertising and sales in that particular category, there's a ton of business, but most chiropractors aren't really good at, or small business people in addition, aren't really good at advertising, and most of them definitely do not know sales, how to go in and get more of the marketplace for very narrow conditions. They don't. And so instead of having the knowledge or the skill set, they go horizontal. And now when you become everything to everybody, it's called violating the law of line extension. You got major problems. You got no credibility, no trust. You got major problems in your marketing now. So that's the second category, was the conditions. Now the third category we're going to go into are the differences between primary needs and service factors, primary service factors and secondary service factors. And we're going to go into this too extensively. But it's the relationship of these factors that are so important relative to personal injury attorney marketing, specifically sales. Now, the primary need factors for the personal injury attorney is, remember, civil suits are about money. They're about monetary. So if they're losing monetary, that hurts. And so they want to not only not lose money, they want to make money. So most attorneys do not realize how much money they're losing by not having a doctor who is good at documenting all these injuries, specifically the most common injury, the connective tissue alteration of motion segment integrity. Most attorneys aren't even aware of this, and most of the doctors aren't aware of it, and they're not documenting it, not doing it, and they don't know how to explain it. And that's a major issue with sales and marketing in the marketplace. So let's be very clear about what's the relationship of need versus services. Well, there's 3 primary needs for the personal injury attorney. Number 1 is loss of money. Number 2 is they want to make more money, and they'll say that to you by, like, they want referrals from you. That's meaning I want to make more money. The third one is saving time. If they have a doctor who can coordinate and quarterback all these activities, it saves them a lot of time. So of those 3 needs, losing money is the absolute highest driver. It's the highest motivation, is the money they're losing. But here's the problem. The money they're losing is they're in a state of unconscious incompetence. They don't know how much their money they're losing. If they did, there would be a need. But the vast majority of these attorneys who are not using chiropractors and patients do not understand, because they've never had any a chiropractor explain to them the value they bring to the table. In other words, how they can stop them from losing so much money. So of the 3 primary needs, 80% of all your time and energy should be focusing on the money they're losing. That's going to have the absolute highest motivation. But our marketing program not only includes sales to show them how much money they're losing, because that's where we want to establish the need, but also how to get more business, how to get more personal injury cases. So we cover both of those. And the byproduct of just being able to explain that shares with them how you can put the case together and save them a lot of time. So those are the 3 need factors. Now there's 4 major service factors. Remember, none of the service factors matter if they don't have a perceived need. The 4 major service factors. Number 1 is location. Number 2 is willing to negotiate the case. Number 3 is the financial, or excuse me, number 2 is the financial drivers. Number 3 is the willing to negotiate the case, and number 4 is transportation. Those are primary, they're not secondary. All of these are very important, and we're going to go over different ways you can incorporate them if you're not doing them in your office, to very easy ways to more complex ways. So the primary service factors, number 1 is location. So you shouldn't be marketing to attorneys that don't have clients within your area. So when we reverse engineer and create your list, that's the first place we want to go, is to the attorneys who are pulling clients out of your area, because when clients miss doctor's appointments, it's the number 1 thing that hurts the case the most. And it doesn't take long for a personal injury attorney to realize this when they're out in practice. Market forces will spank them. And real quickly they'll learn that if they refer a client to a doctor too far away, the client won't make it, and it will really hurt their case. And so they will have a need or proclivity to find pockets of providers. So the good news is, even if you think an attorney is locked up by somebody, well, that's in that particular location, but not maybe in your location. They need somebody in your location. So the primary service factors. Now remember, the service factors are totally irrelevant if there's not a need. And of the needs, which one is the greatest need? Loss of money. So we want to make sure we established in that right side of that curve a need, that how much money they're losing is the primary marketing vehicle, and then supply the service factors, which is number 1, location. And we're going to go into how the importance of understanding geographics and psychographics relative to location, but how you can create greater influence and leverage through location, because there's 3 different ways you can actually have multiple locations. One is just absolutely very easy. And so the more locations that you have, the more influence you will have with that personal injury attorney. And I will cover those. The second one is willing to, or the financial drivers. Now the attorney will say, give me good notes. He'll say the number 1 mistake the chiropractors do is they don't have good notes. Well, what does that mean, good notes? Good notes means they have the financial drivers. So are you tying up the financial drivers with those 5 major injuries? If you're dealing with the connective tissue injury, the disc injury, the neuropathy, and the mild concussion, are you diagnostically discovering those, A, and are you objectively documenting those injuries for your reports? And then also tying those to the financial drivers. When I'm saying documenting, I'm also tying those to duties under duress, lifetime enjoyment activities, impairment ratings, and prognosis based on the 3 phases of healing. So that's the second category. Are you covering the financial drivers? Do you know them? Are you doing them? Number 3 is willing to negotiate. And you can ruin a case, and a lot of chiropractors ruin cases by having huge bills, and if the average case is X amount, and the chiropractor's bills disproportionately over a third for medical bills, a third for the attorney, and a third for the client, then you will naturally destroy the relationship. So you have to be cognizant of what really is this case going to bring relative to your bill. So you keep jacking the bills over what the case value will actually bring, and then you're not willing to negotiate. You just killed that referral source. So we kind of keep it on a third-to-third ratio, but also understanding the different values and being within the parameters and working with the attorneys, because that is a primary need. So location is number 1. Financial drivers is number 2. Willing to negotiate a third-to-third relationship. We'll talk about this more. And number 4 is transportation. that is a primary need. If you are not offering transportation, I strongly suggest you do. Now, there's 3 ways we're going to go into how to do this, how to do the locations, how to do the financial drivers, how to do the how to negotiate the bill, and how to deal with transportation. Then there's 3 basic ways of dealing with transportation. But yeah, you really need to be aware of the importance of these, and why is transportation so important? Because typically the car is in the shop. And that is the first, if you're not aware of this, the very first question or need the client has when they go to a personal injury attorney is, how can you help me get my transportation or get my car fixed? That's the first question, the first need the personal injury attorneys. So if you can come in and help that personal injury attorney by supplying the transportation for the services, that helps significantly. Okay? So that is the transportation aspect. And we'll go into details of the transportation and the different degrees and levels of which you can offer transportation. And then there's the secondary service factors. Now, remember, a primary service factor is a reason for them not to do business with you. Okay? Now, a secondary service factor is not a reason they'll do business with you, but you definitely can lose business if you don't do these. And the 4 main secondary service factors is the attorneys will complain about. Number 1 is not promptly getting your reports in. And they expect the reports in. And I would just ask the attorney, generally speaking, it's 3 weeks from the date of request. But I'm familiar with the difficulties of this, and this is why transcribing makes your notes, using a template and dictating, transcribing, makes note-taking the absolute easiest. So if you are not transcribing your notes and you're writing your notes, you are wasting a lot of time, and you're going to have trouble getting narratives and reports, or you won't be able to see many patients because of the amount of time it's taken for you to write your narratives and reports. So I strongly recommend going to dictation and transcription off templates. Now, the number 1 secondary factor is prompt reports. They don't want to keep asking you for reports, and there's a certain time frame. Generally, that's 3 weeks. But I'd even just ask the attorney, on your first request, how long is it before you expect the reports? And then I would make that an office policy, because you will definitely create bad service, and that bad service is the reason that personal injuries attorneys fire the people. That's why we fire the people we refer to. Generally, if we're satisfied, if we're okay with their business, we won't fire the people we work with because of the second law of nature, security. We'd rather continue dealing with business, even if it's not the best, just because we're secure and comfortable. So, and that's the only way you can take business from a provider, is if that person's dissatisfied, by the way, also. So the second factor is when you ask them to pay for reports. Even though they're going to get reimbursed in the end, psychologically, for them to cut a check and forward any money from you for a case, for reports, or depositions and things like that, that's like money out of their pocket, even though they're going to get paid later. So just be aware that when you, and a lot of attorneys just expect that as part of your, that's what you do. That's your job, is to take notes. And so I would not recommend charging for records, reports, and narratives. That's a good way to kill a relationship. So we're talking about secondary service factors. Number 1 was not prompt notes. Number 2 was asking them to pay for narratives and reports. Number 3 is you definitely want to be able to see the patient on the same day. Those patients are typically injured and they need some type of comfort or pain relief, so they want to start the process immediately. So if they can go literally from the attorney's office, where you have some flexibility, and even if it's not the standard of your office protocol, but getting them in to start the process, even if you don't do the full-blown consultation, examination, maybe you have a whole hour procedure that you do, and etc. But have that ability that you will definitely get them in and eat it, even if it's you just doing a consultation and taking their x-rays and getting them out and doing the and then finishing it up on the next day. But the importance of getting that patient in that same day is a secondary factor, and also not losing the patient from the time they leave. Because remember, what happens to motivation every 24 hours? It decreases. So if the attorney says, well, go over here, and you say, well, we can't get him in until tomorrow or whatever, well, there's a lot of things that happen in the next 24 hours with motivation, and none of it's good for you. So it's best if the attorney literally can just pick up the phone and call you and just send them right over. It doesn't matter how busy you are. Modify, don't be so dogmatic. Modify and do something temporarily that, yes, you can see anybody anytime from that personal injury attorney and start the process. And then the third one is the phone calls. Have an office policy that you accept personal injury attorney phone calls. And so I always had the personal injury attorney, now I didn't say return phone calls. I said accept them, okay? Because they also were in court. So it's hard between you seeing patients and them in court. So when I had an office policy, my staff knew that when the personal injury attorney called, unless I was giving a report of findings, because that's real important to the patient. If I was just treating a patient, that my staff knew to interrupt me. Take the call from the attorney. Okay, the patient can easily go on therapy. That personal injury attorney relationship is more important than an individual patient that's going to come and go. Okay, from a monetary standpoint, that's what I'm referring to when I say more important. So those are the factors. Now, what's the relationship? Well, what's key in this relationship is understanding, putting in place the primary service factors of location, financial drivers, willing to negotiate, and transportation, in addition to the secondary service factors, and understanding the difference between a primary and a secondary service factor, and where to put importance and priority in your communication. And more importantly, understand the difference between perceived need, that none of these service factors matter if there is not a need. Understand this very clearly. And when you go into the perceived need, 80% of all your communication should be based on the revenue they're losing, not what you can do for them. They are constantly hearing from different people what they can do for them. You're not being unique or different in any form or fashion. So we definitely are going to go, we have a system that shows them how to get more PI, personal injury cases, but that is not going to be the motivating factor. That's like some doctors try to solely market using a software program that will document LMSI. Well, that's pretty important, but that's a pleasure-based sale. Unless you know how to take that information and show them how much money they're losing, you know how to quantify it and get that personal injury attorney to see how much money they're losing, that's when it becomes way more significant. If you're just going to show an objective technique that helps them make more money, be aware that that is a pleasure-based sale. That's a weaker sale than a pain-based sale. So be very clear of the difference between need, pain, and pleasure versus service factors, primary and secondary, and what you need to do to get your office in line and your team and all your systems in place. And that's what we're going through in the Personal Injury Attorney Marketing and Sales Workshop. So we're going to go ahead and conclude it. We've just reached an hour, and we'll go into major segments in the workshop. We won't be able to go very deep into a lot of the segments. If you have any questions, shoot me an email with the question. And I will create videos that support a lot of the material we're talking about that I don't have as much time to go into. Okay? So that'll be it for today. We'll see you on the next workshop of Personal Injury Attorney. You take care. Bye.